Take care of your diabetes. Take care of your diabetes during sick days and special times. Diabetes is part of your life. You can learn how to take care of yourself and your diabetes when you're sick. How to take care of yourself and your diabetes when you're at school or work. How to take care of yourself and your diabetes when you're away from home. How to take care of yourself and your diabetes when an emergency or a natural disaster happens. How to take care of yourself and your diabetes when you're thinking about having a baby or are pregnant. Take care of your diabetes when you're sick. Having a cold, the flu, or an infection can raise your blood glucose levels. Being sick puts stress on your body. So, your body releases hormones to deal with the stress and to fight the sickness. Meanwhile, higher hormone levels can also cause high blood glucose levels. Therefore, you should have a plan for managing your diabetes when you're sick. The first step is to talk with your healthcare team and consult your doctor about what to eat and drink, how often to check your blood glucose levels, whether you should check for ketones in your blood or urine, whether you should change your usual dose of your diabetes medicines. Take care of your diabetes when you're sick. Action steps. When you take insulin. Take your insulin, even if you are sick and have been throwing up. Ask your doctor about how to adjust your insulin dose based on your blood glucose test results. When you don't take insulin. Take your diabetes medicines, even if you are sick and have been throwing up. Meanwhile, people who are sick sometimes feel as though they can't eat as much or can't keep food down. This can cause low blood glucose levels. So, consuming carbohydrate-rich drinks or snacks can help prevent low blood glucose. Advice from your doctor in taking care of your diabetes. If you are sick, your doctor may recommend the following. Check your blood glucose levels at least 4 times a day and write down the results in your record book. Then, keep your results handy so you can report the results to your doctor. Also, keep taking your diabetes medicines, even if you can't eat. Drink at least 1 cup, or 8 ounces, of water or other calorie-free, caffeine-free liquid every hour while you're awake. In particular, if you can't eat your usual food, try eating or drinking any of the following to prevent low blood glucose levels. Milk, soup, juice, yogurt, dry toast, saltine crackers, broth or bouillon, ice pops or sherbet, soda that isn't sugar-free, gelatin that isn't sugar-free. When to see a doctor. Have a high fever. Vomit more than once. Have trouble breathing. Have diarrhea for more than 6 hours. Urine or blood ketone levels are above normal. Can't think clearly or you feel more drowsy than usual. Blood glucose levels are above 240 even though you've taken your diabetes medicines. You should call your doctor when you have questions about taking care of yourself. Take care of your diabetes when you're at school or work. Follow your healthy eating plan. Take your medicines and check your blood glucose levels as usual. Tell your teacher, friends or close colleagues that you have diabetes. And teach them about the signs of low blood sugar. You may need their help when your blood glucose levels drop too low. Keep snacks nearby and carry some with you at all times to treat low blood glucose. Tell your school or work health worker that you have diabetes. Wear or carry an identification tag or card that says you have diabetes. Take care of your diabetes when you're away from home. These tips can help you when you're away from home. Get all your vaccines and immunizations, or shots, before you travel. Also, find out what shot you need for where you're going, and make sure you get the right shots on time. Follow your healthy eating plan as much as possible when you eat out. Moreover, always carry a snack with you in case you have to wait for a waiter to serve you. Limit alcoholic beverages. Ask your healthcare team how many alcoholic beverages you can safely drink. Eat something when you drink to prevent low blood glucose. If you're taking a long trip by car, check your blood glucose levels before driving. Stop and check your blood glucose levels every 2 hours. Always carry your diabetes medicines and supplies in the car where you can reach them in case your blood glucose levels drop too low. In case you can't leave for home on time, bring twice the amount of diabetes supplies and medicines you normally need. Take comfortable, well-fitting shoes on vacation. You'll probably be walking more than usual. On the other hand, keep your medical insurance card, emergency phone numbers, and a first aid kit handy. Wear or carry an identification tag or card that says you have diabetes. In particular, if you're going to be away for a long time, ask your doctor for a written prescription for your diabetes medicines, and the name of a doctor in the place you're going to visit. Don't count on buying extra supplies when you're traveling, especially if you're going to another country, because different countries use different kinds of diabetes medicines. Take care of your diabetes when you're flying on a plane. These tips can help you when you're flying on a plane. Ask your healthcare team in advance how to adjust your medicines, especially your insulin, if you're traveling across time zones. Take a letter from your doctor stating you have diabetes. The letter should include a list of all the medical supplies and medicines you need on the plane. In the letter, the doctor should also include a list of any devices that shouldn't go through an X-ray machine. Carry your diabetes medicines and your blood testing supplies with you on the plane. In particular, never put these items in your checked baggage. Bring food for meals and snacks on the plane. If you use an insulin pump, ask airport security to check the device by hand, because X-ray machines can damage insulin pumps, whether the pump is on your body or in your luggage. When on a plane, get up from your seat and walk around when possible. Action steps when you take insulin. When you travel, take a special insulated bag to carry your insulin to keep it from freezing or getting too hot. Bring extra supplies for taking insulin and testing your blood glucose levels in case of loss or breakage. Ask your doctor for a letter saying you have diabetes and need to carry supplies for taking insulin and testing blood glucose. Action steps when you don't take insulin. When you travel, ask your healthcare team in advance how to adjust your medicines if you're traveling across time zones. Carry your diabetes medicines and your blood testing supplies with you on the plane. Ask your doctor for a letter saying you have diabetes and need to carry supplies for testing blood glucose. Take care of your diabetes when an emergency or a natural disaster happens. Everyone with diabetes should be prepared for emergencies and natural disasters, such as power outages or hurricanes. Always have a disaster kit ready. Include everything you need to take care of your diabetes, such as your diabetes medicines, a blood glucose meter, lancets, and testing strips, a glucagon kit if you take insulin or if recommended by your doctor, insulin, syringes, and an insulated bag to keep insulin cool, if you take insulin, glucose tablets and other food or drinks to treat low blood glucose, antibiotic cream or ointment, a copy of your medical information, including a list of your conditions, medicines, and recent lab test results, a list of your prescription names with dosage information and prescription numbers from your pharmacy, phone numbers for the American Red Cross and other disaster relief groups. You also might want to include some food that doesn't spoil, such as canned or dried food, along with bottled water. Take care of your diabetes if you're a woman and planning a pregnancy. Keeping your blood glucose levels near normal before and during pregnancy helps protect both you and your baby. Even before you become pregnant, your blood glucose levels should be close to the normal range. Your healthcare team can work with you to get your blood glucose levels under control before you try to get pregnant. If you're already pregnant and you have diabetes, see your doctor right away. You can take steps to bring your blood glucose levels close to normal, because your insulin needs may change when you're pregnant. So, your doctor may want you to take more insulin and check your blood glucose levels more often. When you plan to have a baby, follow your healthy eating plan. Don't smoke, drink alcoholic beverages, or use harmful drugs. See a doctor who has experience taking care of pregnant women with diabetes. Work with your healthcare team to get your blood glucose levels as close to the normal range as possible. Be sure to have your eyes, heart and blood vessels, blood pressure, and kidneys checked. Your doctor should also check for nerve damage. Pregnancy can make some health problems worse. Note: diabetes is a dangerous disease with many complications related to the kidneys, heart, liver and causes many serious health effects. Understand the causes and prevention of the disease so that you can promptly treat the signs and symptoms of the disease. The purpose is to solve your problem. So be open and ready to experiment. At the same time, choose your strategy, take action and start enjoying the benefits. Reference: Diabetes Freedom, 2 months free solution. Or visit 247naturalhealth.com to all chronic illness information. Link in the description. In particular, if you know Qigong and its miraculous improvements to health, visit falandafa.org. Thank you, I hope you are always happy and healthy. Thanks for watching. Don't forget to subscribe to the channel to receive useful information.